Good evening and thank you for joining us. I'm John Carlin. September is Suicide Prevention Awareness Month, and in 2022, the CD says 13.2 million people contemplated suicide. In that same year, 1.6 million actually attempted suicide. Now, families that have lost loved ones to suicide are coming forward and they want change. 10 News reporter Abby Coleman sat down with two women who are pushing for mental health resources in the face of grief.
When Barbara Gladio and her family moved to Lynchburg in 2009, she never expected it to turn into raising her two young kids on her own.
You anticipate raising your children together, and not to have that, it's just your whole identity is just stripped away.
Her husband Kenneth was a psychiatrist, but while he was helping his patients through their mental health struggles, he was fighting his own.
And he attempted suicide at the house and then went to the hospital and was hospitalized for a couple weeks, and he ended up dying at the hospital by suicide.
Suddenly, she was navigating her grief while helping her, at the time, 6- and 8-year-old kids navigate their own.
Started this counseling, and I practiced with her and practiced in the mirror how I was going to tell my children.
She didn't know anyone in town, but slowly but surely, she found a community of people who had lost their loved ones to suicide too.
But a lot of times that person I told had a story like, my dad would die by suicide.
A community of people like Brandy Jones.
We didn't know he was struggling. We didn't know things were going on.
She tells me she hadn't thought too much about suicide and mental health. That is until she didn't have a choice.
I lost my brother in September of 2019.
But she's turned her grief into grit and dedicated her life to making sure people know there's help, whether they've lost someone to suicide or are contemplating it themselves.
Now, do you realize how important those conversations about mental health are, before the fact?
Absolutely. And I've had people that I never thought of reach out and say, this has affected me and my family. This has happened to me, and it's not public knowledge. So even if I have one person that it's reaching.
Barbara feels the same way, channeling her energy into years of healing by helping others find their community through support groups, suicide prevention walks, and more. But she says more needs to be done before change can happen.
Really, we need more doctors, nurse practitioners. We need people on the ground.
Abby Coleman, 10 News, working for you.
And remember, if you or a loved one is in crisis, help is available. All you have to do is call or text 988. Also, resources can be hard to find, but we have put together a list of some available resources here at home, and you can find that at WSLS.com.